First of all, I would like to echo the concerns that Francis and the previous speaker mentioned about the in-person assisters. We have spent the last few months organizing in the Latino community and preparing them for the enrollment period. And significantly, many of them actually missed the last enrollment period or didn't complete applications because of confusion. So, especially in the Latino community, the face-to-face contact is very, very important. The second issue I would like to address concerns another topic that may not be quite as pressing, but I think should take a place on the agenda of Access Health, and that is the question of network adequacy. At the last meeting of the Consumer Experience and Outreach Committee in April, we discussed at length the necessity to have an independent verification of the authenticity of the networks that are offered through Access Health policies. Just recently, at an appointment with my primary care physician, 10 of my precious 15 minutes were devoted to her explaining to me that 2 patients who had Access Health policies, 2 different carriers, both had trouble finding a gastroenterologist in the greater Hartford area. That although they were listed in the networks, they were not available. One was only seeing patients in the hospital, another was only seeing patients if they had liver disease, et cetera, et cetera, et cetera. So the result of this was that the only place they could find a gastroenterologist in the greater Hartford area was UConn, and the wait time for that appointment was extraordinarily long. A couple of days after that, my employee attempted to make an appointment with a podiatrist. We had, as a business, nonprofit business, we bought an Access Health policy through the SHOP program. And she went to the doctor's office, and they said they had no idea what this insurance was. And of course, I checked previously, and that doctor was in the network. So I did what I think most people do who have this problem. I looked at the card, and she and I called the phone number on the card. It was not Access Health. It was the carrier. So the fact that Access Health is not getting inundated with phone calls does not necessarily mean that there is not a problem. The problem is being directed to the insurance carriers, and they're not going to report problems with network adequacy because, well, for self-evident reasons. So I would just urge the board to consider putting on its agenda some sort of authentication system for network adequacy, as this is a problem in other states. I know it's not as immediate and urgent as the personal assisters, etc., but I do believe that being ahead of the curve on this one serves us very well. Thank you very much.